Let's help your sinuses, some allergies maybe even, and we'll start with the hyoid bone. So we're going to grab it. It's a horseshoe-shaped bone right here underneath, above the thyroid cartilage, and we're just going to pull it gently from one side to the other. There's a lot of muscles that attach to the hyoid bone. It's this unsung hero at your base of your throat. So we're just going to pull it back and forth. You'll feel this just kind of pull this area, and let's see if we get some drainage. Let's see if we can get some fluid flow dynamics going, decrease some stagnation. And now let's see if we can pull it just a little bit. Pull it and let it relax. Just a light pull, just pulling it. There it is. Good. Nice. Let's do a little fascia over it. So just grab your skin. We'll do some skin pulling, which kind of pulls the fascia in the area, just like this. Loving that hyoid bone. I never actually went to a seminar. Okay, here are the 17 malpositions of the hyoid bone. It's really not a big thing in chiropractic school, but it is something that's so valuable for swallowing, for drainage, for singing, for talking. Okay, let's get on your cheeks now. We're going to massage those cheeks. Let's go for it. So just really give me some circular motions. Let's get the sinuses moving, the maxillary sinuses. We're going to go for the ethmoid even, the sphenoid sinus. Just keep moving though. And I am going to use a vibration tool today. The amplitude of it is only 1/16 of an inch. And so if you do have a vibration or a massage gun or something like that, you may want to use it over your hand instead of directly on your skull and your face. But let's see how we do. Just keep moving. Just go for it. Let's give some vibration with your hands, some manual therapy. And then the other direction. This is you being the influencer. I love it. This is just self-care. This is taking care of you. Oh, healthcare is, waiting for my doctor. Nope, it's you taking things into your own hands. All right, so now we're going to go either side of the bridge of your nose with your index fingers, just right here. This is for the ethmoid sinuses, between the corner of your eye and your nose, and we're going to push in. Oh yeah, we're just going to gather some tissue together, and we're going to slowly, ever so gently, pull down the bridge of your nose, on either side of the bridge of your nose, and just coming down. Woo! Drainage be happening. Okay. Oh, right all the way to the nose. Let's give it another one. Pushing in, pushing even up a little bit, up into the orbit, and then down towards, so the fingers are being pushed towards one another, and then bringing it on down. Let those shoulders come down. Relax your face. The chest is up. The head is up. The posture's doing great. We love good posture. Good. And then bringing it down. Good for the ethmoid sinuses. Good. Let's go one more. Pulling it down. All the way down. Nice. Even close your eyes. Just kind of feel it. Tap in. It's your body. Good. Let's do real hard on the sinuses now with your knuckles. Just go on either side of your nose and just push in so it hurts. Like we want some pain here. And then we're going to let it just sink. We're going to let it sink and then just kind of drag out. So keep letting it sink. Just push in. You might even feel your knuckles just kind of drop down into your face a bit. And that way, when you drag, you're going to be coming more from underneath rather than just superficially. We want to go deep. We want to go deep and superficial. Okay, so now we're going to pull it apart. Just slow, just agonizingly slow. There we go. Opening up those nostrils. Getting things to drain. I think I am draining. Pulling it on out. As you pull out your smile. And good. All the way out. All the way out. Good. Let's go one more. The knuckles go just a little bit lower this time, a little closer to your nostrils, and then pulling it on out. And you'll have some stripes across your face, we hope. Again, nice and slow. I want this to feel a 6 or a 7 out of 10 in pain. Okay, now I'm going to I like the rapid release. You can find one that's good for you. Okay, so we're going to vibrate And we're going to do the sinus vibration. So we'll go in here, and again, pulling out like this. And this one, you can go a little faster. Nice. Feel that vibration. It just goes throughout your head. Movement is pain relief even. You know, you hit your hand with a hammer, you shake it, you feel better. Massage feels better. Movement is relieving. Okay, let's go to the other side. Okay, now we're going to go to the sphenoid bone. It's just behind your orbit right here. And we're just going to vibrate that one. And just relax your face and breathe in slowly in through your nose, slowly out through your nose. Make it a quiet breath. And then do some circular movements right there on that sphenoid bone. Very important bone. Your brain sits on top of that bone. It just happens to peek out over here. And your cranial bones are attached to that bone. You've got 22 bones in your skull, and the ones in the back of the cranial, and they attach to the sphenoid. So let's go the other side, right behind your orbit, right there. If this causes dizziness, you don't feel right, a little nausea, just skip it. That's okay. Find one of my other videos. Good. Sometimes this will free up the ear. I work a lot with eustachian tube dysfunction and use this move also. Good, now we're going to go to something called bregma. Bregma is, if you take the heel of your hand here and you go up to the top of your head, you'll find this place called bregma. It's where some bones, the frontal bone and the parietal bones come together. And oh, here goes my hair, but this is just going to feel great. And again, relax the face, allow it to vibrate. You know, even a good voice, just a good resonance to your voice will help the sinuses. Vibration is excellent for your sinuses. Do little circles, little circles. Again, if your vibration is too harsh, just go like this and do it on top of your head. That'll work also. Good. Okay, let's go over to the temporal bones. Your temporal bone's about right here, and so we're going to go just about a finger or two distance above your ear, and then just go right on there. Okay, with this one, let's just open the mouth and waggle the jaw back and forth. With allergies, it's an overactive immune system. So oftentimes the gut is too permeable. Things get in through the gut that shouldn't, and then the body says, oh, I need to attack that, right? Maybe an undigested protein or something that shouldn't be in there. And so helping heal the gut, let's go to the other side, can actually help with allergies also, along with detoxification and just eating real food, not eating food products. I don't think there's really any such thing as health food or junk food. There's just food or junk. So choose food. Choose food. It's a good thing. It'll help those allergies also. Okay, so now we're going to go, now that we've moved things around a little bit, we're going to go a little bit into lymphatics over on the side of the neck here, and we're just going to bring it down and try and flush it all out now. There you go, just like this. And let's go to the other side. Now your neck, your upper part of your neck here, and the lower even, but is really attached to your sinuses also. So what we're going to do is we're going to do a 45-degree neck stretch right here, and then we're going to go up there with the vibration. Now if this is too intense, come down here, you're still going to get some good vibration. Sometimes you might feel a little ooh, because it's really stimulating some proprioceptors. Now let's start at the occipitals and bring it on down. We don't want stagnation. We want movement. Let's go to the other side. So we'll start here and just vibrate. And if you feel comfortable, bring it up to the top and pull. Tuck that chin and just get that place between your skull and your neck opened up. It's often closed down because of poor ergonomics. Beautiful. Go ahead and put down your vibration, and then let's do something a little bit harder. Let's go right here with the fingers right there underneath that suboccipital area and just work it. Okay. All right, I hope that helped those sniffles, and you can go out and play on the grass again and enjoy the flowers.